Good morning, I'm Amy Lynn. Many Americans have or have had a bottle of opioid medication in their cabinets, but few realize the potential dangers of getting one of these prescriptions filled. So what should you do if you're prescribed an opioid? Joining us with the answers is David Calabrese. He is the head of the pharmacy for Optum RX and a member of the internal task force at United Health Group, and he's addressing the opioid crisis. Thanks so much for being with us this morning, David.
Excellent. Thanks for having me.
It's great to have you this morning because I feel like the opioid crisis is so big right now, and it's just so sad and scary, and we need to talk about it. We need to talk about alternative options. So what's the conversation that you should be having with your doctor?
Yeah, I think it's important that people, first and foremost, not be intimidated in asking their doctors questions. Yes, our doctors are very well educated, very well trained, but in today's day and age, it's critical that with the highest quality of healthcare that should involve informed decision-making, joint decision-making between the provider and the patient. So it's about asking questions. If the doctor is going to prescribe a pain medication, you want to know, is this an opiate medication or isn't it? If it is an opiate medication, is it the right medication for me?
Okay, so realistically, how easy is it to become addicted to an opiate, even if you haven't had it before?
The unfortunate part about this epidemic is that it knows no boundaries. Yes, there are folks who are more predisposed to potential dependency and addiction. So if you have a history of substance abuse in your family, if you have a history yourself of some type of, whether it be alcohol abuse, smoking, other addictions, you may be at higher risk.
It's so scary. Okay, and that brings me to my next question. So if you're not using the medication, what would you recommend that we do to safely dispose of this unused medication?
You can contact the DEA via their website, and they'll show you in your area various locations that you can visit to return these medications and have them disposed of properly.
I actually did not know that. So that is great information. So to avoid these opioids, we need to contact our doctor and see if there's a different route that we can go. So you want us to do that, correct?
Yeah, and you know, again, there is a very valid role for pain medications, right, depending on the condition. But there are also alternatives.
Well, David, where can we actually go to get more information on this?
I encourage folks to go to some of the national sites, such as the CDCgov, which is the Center for Disease Control and Prevention.
Thank you so much, my friend. You have provided great information this morning. Find out more by logging onto our website, fox4morningblend.com.